Interpretation of ABGs, right? Interpretation of ABGs. ABGs is very important, you know. Sometimes it's very difficult to interpret the ABGs. Like from the ABGs, we can say that the patient has metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis, or mixed acid base disorder, right? So today I will share some very quick and easy trick so you can easily understand that whether any problem the patient have or the patient ABGs have, right? So after taking the ABG sample, we send the ABG sample, and after looking at the ABG report, we can say that the patient has a certain problem. So after all, there are many factors that affect the ABGs, but to know and to if you are working the emergency, right? So basically the values in the body, right? So in the quick understanding of the ABGs, we have to look on the three parameters: the pH, carbon dioxide, and the bicarbonate. So for interpretation, we have example like patient 1, patient 2, patient 3, patient 4, and patient 5, or whatever. In these, we will see the values of ABGs, right? Here we can draw the ABGs parameters: pH, partial pressure of carbon dioxide, and bicarbonate. Although there are some other factors, we can say sodium, potassium, and many others, but for now we only look at three parameters, right? So after all, the patient will have this problem: either it's respiratory, metabolic problem, metabolic, respiratory, or mixed acid base disorder, right? Mixed acid base. In metabolic, it can have acidosis, alkalosis, respiratory acidosis, right? Respiratory alkalosis. So in the mixed acid base disorder, we have both, right? So going back to the parameter, like we have patient 1 have the 7.3, 30, 20, right? And the patient 2 have 7.5, 45, 30, and the patient 3 have it can be any value, right? So patient 3 have 7.3, 7.45, you can say that, or any value, 30 value, right? So when it comes to the ABGs, we will draw the arrows first, right? The first step is to draw the arrow, and we will see from it the normal value. You know, it's 7.3, and the normal value is 7.35 to 7.45. So it shows that it's less than 7.35. So we will draw the arrow downward. So here is the 30, and we see the normal value, that is 40. So it's going downward. So we draw the arrow downward, and here is a 22, and here is a 20. So it's also going downward. So three arrows in the same direction. It shows it's some metabolic cause, right? Metabolic cause, showing some metabolic cause, right? So the second one, we'll see that here 7.4, 7.5. So it means it's going upward, right? And it's a 45. Right? It's also going upward, and it's 30. The normal is 22, 28. It's also going up, and three direction also in the same direction, but it's going upward. So here we will see that either it's metabolic alkalosis, either it's metabolic acidosis. So what we do for that, we see the pH. It's 7.3, right? It's 7.3. It's less than 7.35. So when the pH is less than 7.35, it means it's acidosis. Acidic environment is going on. So we can say that this is metabolic. This one is metabolic acidosis, and this one is metabolic alkalosis. So it's very simple and easy one. So for this, now look at 7.3, 3 is less than, and this is this is partial, it's going upward, and this one is also going upward. So here three arrows are not the same direction. These two arrows and this arrow is in opposite direction. So we can say that this is a respiratory problem. It's a problem in which any one of the arrows in the reverse direction. And remember that the fact is that in which direction the carbon dioxide will move, the bicarbonate follows the same direction. So anyway, the carbon dioxide and the bicarbonate will be in the same direction. The only change in direction is the pH value. So in this case, it would be the respiratory. In the case in which the two arrows in the same direction and the one arrow is in different direction, that would indicate the respiratory problem. So it's going downward. So it's a respiratory acidosis. So this is a respiratory acidosis, right?